Welcome to the world of Bruxism. Most people think Bruxism is simply grinding your teeth, but it isn't. Bruxism encompasses grinding and clenching with enough force and often enough to damage the teeth, the muscle, the joints, the gums, or any dental work. Now here is where it's going to get very interesting, because there isn't just one type of Bruxism. We have a sleep Bruxism, which happens while we are asleep, and also we have awake Bruxism, which happens while we are awake. They are very different. A sleep bruxism is fascinating because the brain isn't asleep the whole night. It's going to move through different stages of sleep and reacts to what is happening in your body. If your breathing becomes more difficult, if your airway narrows, if your nervous system becomes activated for any reason, the jaw muscles can become active as well. Think about it for a moment. Your body only has one job while you are asleep, and it's to keep you alive. It doesn't care if you're feeling cracks. It doesn't care if your crown is gonna break. The priority is breathing, so we can get enough oxygen into our brains. So a lot of people think that bruxism is just a habit, but the reality is, why is the brain switching those muscles? Now, day bruxism is different, and a lot of people have done it. You might be driving, working, trying to meet a deadline, arguing with someone, reading an email that annoys you, and then you suddenly notice that your jaw is very tight, that you weren't chewing anything, but what you were doing is clenching, and that is awake bruxism. For many people, stress doesn't end up in the shoulders, it ends up in the jaws, and they don't even realize that they are doing it. So now let's talk about the price of bruxism, because this is where maybe dentistry not always look at the causes, and a lot of the times if something breaks, we just replace the filling, or we make another crack, or we repair the cracked tooth, or restore that little space near the gum, or we graft the recession. But what we need to do is stop and think, why are these things breaking in the first place? Because if the force is still there, so the mouth is never going to get a chance to recover, and things are going to continue failing. I've seen many patients who have had the same tooth restored 3, 4, 5 times, and the problems continue. But it's not the material that has the problem, it's not the dentist necessarily. The problem is the load that those teeth are getting. So let's talk about this little groove near the gum line. So a lot of patients ask me, am I brushing too hard? So yeah, maybe. But this is not the first question that we want to answer if it's just brushing, because the neck of the tooth is one of the weakest areas on our teeth. So if you keep bending a clip back and forwards, eventually it's gonna break. Obviously, teeth are much stronger than paper clips, but they respond to repeated loading too. So over time, excessive force can contribute to stress in that cervical area, the area above the gum. And aggressive brushing, if you add it, acidic drinks, or the gum with a very thin tissue, then we have many factors working together. So it's usually about several things that are happening about the same time. It's not only just one cause. So the same thing happens with recessions. Are you brushing too hard? Yes, maybe. But what if the tooth has been holding a lot of force during many years? So that repetitive overload on the tooth eventually is gonna get that area weaker, and then we're gonna have those recessions, and also we're gonna have what we call abrasion. So abrasion is when the structure of the tooth starts wearing out on that area near the gum. So once we start asking those questions, are we looking at overload, not just brushing, so we start getting answers. But what is the real cost of bruxism? Is the actual gradual loss of tooth structure that you will never be able to put back, restorations that fail before they should, the muscles never fully relax, and then the jaw joints become overloaded. So we have many things that happen: recession, cervical abrasion, fractures. So dentistry eventually becomes more complex because the problem is recognized too late. This is why early diagnosis matters. Not every patient needs to wear a splint, but we need to recognize when these patterns are happening so we can protect before any damage happens. So once everything starts getting fractured or lost, we can rebuild it, we can protect it, we can restore it, but we cannot give you what nature gave you. So if you remember anything from today's episode, is this: don't wait until something breaks. If you wake up with a sore jaw, or if your partner tells you that you grind, or if you keep breaking fillings and your teeth start becoming shorter, most likely we are having a case of bruxism. So don't ask only, how do I fix this? Just ask, why is this happening? Because the earlier we understand what is happening, then we can protect your structures from that damage. Most of the time, asking the right questions is more valuable than just placing another filling. If you like this video, please subscribe to our YouTube channel. For more information, you can go to www.vipdentalclinic.com.au, and take care, and we'll see you in our next episode.